Children in South Africa receive immunization against diseases such as severe cough, diphtheria and tetanus in a series of doses as they grow. And these work best when they're actually given on time and in line with the expanded program on immunization from the National Department of Health. Early immunization doses actually also help to protect babies and young children when they are most at risk. And with schools currently open, parents are also being urged to use this opportunity and ensure that their children receive immunization from 6 weeks after birth and at which ages they should be repeated. Now, some schools also offer school immunization days, especially for children who may have missed those earlier doses. And to take this discussion further, we're now joined by Ms. Shaakira Abrahams, who's the medical manager at Sanofi South Africa. Shaakira, we are pleased to have you with us on the show. Welcome. So firstly, talk to us about the importance of immunization of South African children.
Yes, of course. So immunization has been important for decades, right? And as we've gone along, we've advanced in technology, we've developed more vaccines to protect our infants as well as our children against dreadful diseases, right? And these are the diseases that we've seen in the past, but because of vaccines and the effectiveness of vaccines, it still exists, but we don't see it as often, right? And this really just speaks to the importance of immunizations and vaccinations within our healthcare system. And if you look at our immunization program, right? So these includes vaccines that are quite important against severe diseases that might cause detrimental healthcare impacts in our country.
Please further unpack on that. I mean, how important is also information, Shaakira, on immunization programs, especially for parents of school-going children, as that is also the center of where most breakouts and infections actually take place?
Yes, of course, right? So it's important to equip ourselves with the knowledge, but also speak to our healthcare providers, right? So go to your nearest clinic, speak to the expert in the field. And I know these days there's a lot of misinformation that's going around, but all local clinics should be equipped to share this type of information. If you go on to websites about the diseases, diphtheria, tetanus, whooping cough, coughing specifically, right? So you'll see all the information about the impact of the diseases, the consequences, right? So, for example, whooping cough, this is a severe respiratory disease, right? That can cause major illness and especially infants who can't be vaccinated, right? So this is why we want kids who entering the school system to get vaccinated because it's quite a crowded space, right? And they can go home and then infect or transmit the disease to infants under 1 year old, infants under 6 months, and also those who can't really get vaccinated, right? And of course, these are diseases that we see that can be fatal, like tetanus, right? Diphtheria that can cause major illness, that can cause struggling with breathing. We have whooping cough where you can get long periods of violent coughing and in severe cases shortage of breath for short periods of times, right? So these are all diseases that can land kids up in hospital, so we need to protect them against it. So we need to also make sure that we adhere to the vaccination program, getting our infants vaccinated when they are born, getting them vaccinated when they enter the school system, because immunization and vaccination also, the immunity does wane as we grow older. So we need to get boosters for these vaccines as well.
Absolutely, Shaakira. I mean, we've seen the successes when it comes to polio immunization, right? So what then would be the most common as well as readily available and compulsory immunizations for children, Shaakira, in terms of the national EPI schedule that is quite rigorous also to note? And how do parents also get access to the schedule, just to speak to that?
So like I mentioned, the immunization program consists of vaccines that are quite important. So I feel like every single vaccine on that program is important, especially those in the primary phase, right? So those are your 6 weeks, your 10-week, your 14-week vaccinations, especially against diphtheria, pertussis, whooping cough, and then tetanus, right? So you can go to, take your kids to the local clinics. They can get the vaccines for free as it's part of the immunization schedule. They can get education on it. So it's quite easily accessible for our kids to get vaccinated, as well as getting the boosters when they enter the school system, right? So like you've mentioned, there are these school vaccination programs that happen annually, where kids can get these vaccines, but it's also important for parents to then sign the consent forms so that these kids can get access to the vaccines in school.
And just how many immunizations does a child actually get here in South Africa, Shaakira? And how important, you've just mentioned that, for parents to ensure that they actually do complete the immunization schedule. And what are the risks then of not completing the immunization schedule if we actually go deeper, Shaakira?
So there are quite a few vaccines, right? But there is a schedule for it. So you won't be inundating the child with a lot of vaccines at the same time. So there's a clear schedule for when you get which vaccines, also based on the age and based on the risk of the child getting exposed to these vaccines, right? So I think it's quite important to stick to it, to understand when your child needs to get vaccinated, to understand when they need to get their booster vaccines. And just like I said, just speak to a healthcare provider to see when your child is due for these vaccines. So, yeah.
All right. And in closing, I mean, the issue of mostly rural and township children, Shaakira, not having access to clinics in some instances for these makes for quite a serious challenge, right? As these children remain at constant risk. So what needs to be done, you think, in order to reach every child in the country, especially when we're taking in the issues of immigration as well as the integration of such communities as well?
Yeah, I think that's an important point, right? And I think this is where we, even as, the pharma industry, the National Department of Health, other stakeholders that supply the vaccines, we all come together to work collaboratively to make sure that these zero-dose communities do get the vaccines in place, right? So it's not just one specific stakeholder that needs to be involved or needs to drive this, but it requires a community, it requires collaboration from all of us to make sure that these kids are protected, that these kids do get vaccinated. In especially those communities where it's very hard to reach.
Thank you so much, Shaakira, for that. That is Ms. Shaakira Abrahams, who's the medical manager at Sanofi, on the importance of immunization of children in order to protect them against risky diseases as they age.